this, the double lumen once in my life, and I think it was back at Chippenham. We actually had a ventilator on each side of the bed, hooked up, one to one lung, one to the other lung. And I don't remember what was wrong with the patient, I can't tell you that. I've never seen that or heard of that here in Richmond.
Yeah, the
again.
NBRC will ask you questions on it. The question they ask is, what type of tube that you would use for independent lung ventilation? And they go EP tube and the Collins tube and esophageal, tracheal, combi tube. They give you a bunch of tubes. Which one is it? Collins tube.
So those are on the boards.
Double.
It's ridiculous. Those are, as much as we don't use them. The LMA is the most common one that we see out in the field.
The LMA, it's in page, the last,
8. Yeah.
that's page 8.
Yeah.
We keep those in our emergency.
When did those
bag.
come out?
Yeah. Who knows? When were they invented?
I've never seen it before until now.
Really?
Yeah.
I don't know, honestly. I just know I hate them.
Do they work?
Yeah, if you get them in correctly.
Anesthesiologists will use them too. for
They do them a
surgery.
lot during surgeries if it's a short term and they know you're not going to be on the vent.
Short term, but if they've got issues where they're going to be hard at it.
They'll use those,
All right.
but
If
not
you-
for ventilators.
With this LMA, you don't need a whole lot of experience doing anything. You just need to open the mouth and stick this in the mouth, okay? Only thing that you're doing is, when you put it in, it is covering what? It's actually blocking the esophagus and it's covering your trachea, right? So when you put air through here, it's going to go into the lungs because of the shape.
Take a
So they
mask
don't
from the
aspirate.
ambu bag, shove it down your throat.
That's basically it.
And stuff pools in that little boat.
Yeah. And the exam, they will ask you, they want you to understand about this tube. Where does this little mask actually fit? Over the esophagus or the trachea?
Sure.
It fits over your trachea. And it seals off, and when you ventilate, the air actually goes into the lungs.
So it seals off the esophagus, but covers
The
the
trachea.
trachea.
Correct. You can look at your paper.
So there's no tube going into the trachea. It's just blowing air into the trachea.
LMA inflatable mask position directly over the opening into the trachea.
Well, that one looks very different than the one you have in your hand, the picture. What is
The
that?
shape.
well,
more round.
Yeah, different kind of.
Okay.
That's all.
All right.
Like this one here, this one will go in. This port and this balloon will shut off the esophagus. Where now the rest can just go into the trachea out of here. So you got to position it just right. So this doesn't go all the way into the trachea. This sits in the esophagus, blocks off the esophagus, and then the air blows up
Is that
into
the
the
double?
trachea. No, the double.
What is that one called?
That's,
That's just another LMA, just different.
No, is this
Double.
That's
the?
actually a different version of an EOA in a way.
Combitube.
That's the
Esophageal
Combitube.
Tracheal
Yes.
The one that Helena is showing right now is the esophageal
That's the
combitube.
same concept as an EOA right there, it just has a little extra tube with the air.
Two. And then this is all crazy.
All right, the first
The
one,
double lumen
the
combitube.
first tube that Helena showed you all, that goes into the trachea. Okay, which is the Carlin's tube. Carlin's tube, you have to intubate the patient, like you usually do. Page number 7 on the top. Yes. You need to learn this because it's on the exam. I remember looking at the NBRT exam, they asked me questions. So don't just skip it.
Carlin's, which one?
Carlin's tube, You insert this on the left or right main stem.
This.
Yes, the Carlin
It's like
tube.
a giant,
It's a cord.
Yes.
right?
And that's what this is, the other
Like
one,
this
this is
kinda.
basically the same thing.
Oh, you,
These are sealing the
you put it-
esophagus where the air's coming in.
You want it to go-
And this is
It's
the-
either you intubate just like a regular tube, it's in the
See,
right
this
main
is a
stem
good example
or
of
left
the
main
difference
stem.
between the two balloons.
You don't blindly stick this in the
This is like
patient,
high pressure.
like in the esophagus,
With
no.
the EP tubes.
It has nothing to do with the esophagus. You read this, page number 7 on the top. Two independent lumens on legs. Each lumen ventilate one lung separately.
So this is your Carlin.
It has two cuffs,
Can't blow this.
so it's only for one,
Got this lost. It's
and if you
lost
want
its
to
inflation.
ventilate right or left lungs, you can ventilate with this.
These things blow up, you have to use like.
You probably need
20
one of
cc
those
syringe.
cameras for that.
Yeah,
This is it.
yeah.
They would use it for like.
This could be used
So-
for female urinary tract too.
All right, let me ask you all something. Double lumen endotracheal tube, which is Collins tube, is it go into the esophagus or the trachea? Where do you insert the tube? This one, the double lumen. Yeah, it has nothing to do with the esophagus. You either ventilate the right or left lung with this, okay? Which tube that actually, you can put it in esophagus? Yes, esophageal trachea combo tube. Okay, what does that do?
Closes off the esophagus.
Yeah, when you inflate one
can't
cuff, it
pass
closes off the esophagus and opens up the trachea.
Is it this one?
What is LMA? That little mask that covers up the trachea and closes off esophagus. So which one of these two you would place it blindly without any kind of
it says that esophageal tracheal
Laryngeal
combo
mask, you wouldn't
tube, that this device is placed blindly into either the
Yes.
trachea or the
In an
esophagus.
emergency situation, you can place esophageal tracheal combo tube blindly.
Yeah, and it says you can do it either into the trachea or esophagus.
Correct.
See that one?
Yeah. Where is that tube, Helena? Say esophageal tracheal combo tube.
In the,
This,
That's it right
It's
there.
the one with the two things on it straight with the
This
two
one.
cuffs.
so
That,
which ones?
that's
oh,
it.
That's
here.
the combo.
So which ones? You said which ones can you do
Double.
blindly?
The esophageal tracheal
And
combo
the,
That one?
and the,
Yeah.
LMA?
LMA, yes, you could do it too. You don't need it.
That's it, okay.
But mainly in emergency situation, they use this esophageal tracheal combo tube because you just stick it in. If it goes into trachea, it's fine. If it goes into esophagus, it's fine. But you need to find which cuff you need to
The
inflate.
double thing.
If it goes into the esophagus, which
Yeah,
cuff you
one
need to
goes
inflate?
down into the left, one sits on the right.
Yes. Yeah, that's all. How do you know which one you need to inflate? You need to listen to the patient's breath sounds and you inflate this one and no breath sounds. Deflate that, inflate this one and listen to the breath sounds.
So, but wouldn't you, you're gonna inflate the smaller one no matter, well, not no matter what, but if you go esophagus, you inflate that one, then you inflate the other one to keep fluids from going down in the trachea, right?
Right, I mean, the thing is, after you place this in, you don't know where you actually in.
Verify.
You don't know whether it's in the esophagus or when in the trachea. But how do you know? You inflate one of them and listen to the breath sounds. And if there is no breath sounds, you know that's not it. You deflate that one, inflate the other one, and listen to the breath sounds. Okay?
Danny, does this go in like this or like this?
Kinda like your
Like you're, like that,
It
'cause
goes
you're
in
gonna wanna.
upside down, then
No.
you twist it.
bend and twist.
Like that?
And then you twist. Don't you twist in the back?
No, how you gonna turn that
No,
around?
this
Put it in
sits
sideways.
down
And then you twist it so it's
to block
flat.
off the esophagus,
Right.
and then this blows into the trachea,
So wouldn't you wanna insert it?
just like this into the mannequin. So then you're blocking off the bottom esophagus, and all this air can blow up into the trachea.
Well, don't you put it in sideways though and then twist it so the tongue isn't forced back?
Like a pharyngeal airway
Yeah.
thing?
No.
No, oh, okay.
That might have fit.
You gotta have more, smaller. So, the emergency situations, what kind of tube you would prefer on an emergency situation? Like, somebody outside, not in the hospital.
LMA
Yeah,
or,
like
or combi tube, or the combi tube.
combi tube you use, which one is the one you use the esophagus? Like, you don't know where you.
Combi tube you can stick in there,
In
doesn't
the-
matter
in
where
the
you stick it,
esophagus,
you just
yeah.
have to
Esophagus.
inflate the cuff and listen and determine where it's at.
Right.
So the common tube, when you stick it in there, it's blocking all the esophagus. That's just-
Combi tube, you can have either. You can put it in the trachea or the esophagus. But how do you know which one you need to inflate?
You have to listen to the breath
You
sound.
have to listen to the breath sounds and inflate one, and if it doesn't work, you
Okay, once you
inflate
found
it.
out where you've got it, let's say it's in the esophagus,
Uh-huh.
okay?
Deflate.
You're gonna inflate, you're gonna keep, which one do you keep inflated? Or do you
If it's in the
inflate
esophagus,
Mhm.
which one do you want to inflate?
the one with the
First
esophagus,
balloon.
right? You wanna inflate
Or
that
first.
one?
The first
Yeah.
Yes.
First, because you don't want to.
So the other one will be open.
So you don't ever inflate that one, you just
Correct.
leave it, okay?
Yeah, then you ventilate.
Okay.
But if it goes into the trachea,
Then inflate the trachea one.
leave the other.
Yeah, but it's very easy
Nothing's
to
gonna go-
intubate
nothing's
the
gonna go
esophagus
past
with the
that.
head position.
It's
That
gotta
tube, you
inflate.
should be able to put it in the esophagus 99 out of 100 times.
Yeah, yeah.
If you hold the head in the right position.
But you
it
never
just-
know. You never know. It's blindly inserted, so they just do this like before, right before they intubate. Okay, oh, this is an extremely important question they ask. You have somebody with the esophageal tracheal combi tube in place, a patient coming in the emergency room, and the doctor, what would you do as a therapist to put this man on the ventilator for continuous ventilation?
You-
What would you do?
You would have to change the tube.
Yes, you would have to change the tube. How do you do it?
You would,
You pull the tube out
you have to,
completely?
you have to deflate the cuff and, well, after you, yeah, so you have to hyperoxygenate. Which,
Well, you have to insert the ET tube.
oh,
As
okay.
you insert in the ET tube, you pull the other one out.
After you deflate the,
That's also on the exam, okay?
so you
So
deflate.
you
the-
do not
you
actually
deflate
completely
The
remove the
combi
tube.
tube, you have to deflate
Then
it,
intubate,
put the
no.
thing down, because you're not
You
gonna
have
get
to
it down without
intubate first,
deflating.
secure
Or
the
do you, can
ET
you
tube,
get it
and
down?
then pull
There's
the
your-
other
Right,
one
because
out.
that's blocking off the esophagus.
Yeah, so if it's blocking off the, if it's the esophagus is the one that it's,
Well, John, the problem
you
is,
can put it down.